All right, ladies and gentlemen, welcome to the second video of this series. In this video, we're going to talk about the posterior arm and scapula. Okay, so these are going to be muscles that are going to be running over the posterior aspect of the scapula, and these are going to be a couple of muscles that are included in the rotator cuff, three of the four to be exact. And then we're also going to have muscles of the posterior arm, which is pretty much just the triceps and a small muscle called anconeus. Okay, so let's go through it. First thing, we have the bony diagram over here. So we're going to go over the important bony landmarks, and some of these are going to be attachment sites that we're going to see as we go through the individual muscles. Okay, so first thing, let's look at the scapula. So we've seen before this part right here, this angle that is on the superior part of the scapula. You guys saw it in the previous video. This is the superior angle of the scapula. Likewise, we have an angle down here. This is going to be the inferior angle of the scapula. And then we have a border that is out here. Okay, and if we're looking at the posterior side, that means that this here is the lateral aspect of our image, and this over here is going to be the medial aspect of our image. So this right here is going to be the medial border of the scapula, and likewise this right here is going to serve as our lateral border of the scapula. Okay, so now we got the groundwork. Now, a thing that you see on the posterior aspect of the scapula that you will not see on the anterior aspect of the scapula is how the posterior aspect of the scapula is divided into two fossae. All right, when we looked at the anterior side of the scapula, we saw that there was just one big fossa there. It was called the subscapular fossa. Over here, we're going to have two fossae. We're going to have one right here, and then we're going to have another one right here. And notice that both of these fossae are divided by a prominent, very prominent piece of bone right here. Okay, and this prominent piece of bone is known as the scapular. Let me write it out for you. The scapular spine. Okay, this is the scapular spine. The scapular spine starts on the medial border of the scapula at this point right here. This is known as the root of the scapular spine. Okay, that's the root of the scapular spine. And later, when we talk about the muscles of the back, you're going to see how the root of the scapular spine serves as a distinguishing feature for us to identify muscles of the back, such as the rhomboid major and the rhomboid minor. Okay, so it starts here at the root of the scapula, at the root of the scapular spine, and then projects up this way. Okay, and gets bigger and bigger and bigger, and then it terminates as this huge prominent piece of bone right here. That huge prominent piece of bone right there is known as the acromion. This is the acromion. Okay, now, so we have the scapular spine. The scapular spine is going to divide this posterior aspect of the scapula into two separate fossae. And what are we going to call them? We're going to call them in relation to the scapular spine. So we're going to call this this is essentially the fossa that is superior to the spine. So we're going to call this the supraspinous fossa. Okay, that's the supraspinous fossa. Likewise, this guy down here, what do you think that's going to be called? That's going to be called the infraspinous fossa, like so. Okay, infraspinous fossa. Beautiful. This is also something that we saw in the previous video. This is a small notch that is on the superior, that runs on the superior border of the scapula. So we're going to call this the suprascapular notch. Okay, that's our suprascapular notch. And with that, one more. So we have the suprascapular notch, and then we have this tiny projection of bone right here that is inferior to the glenoid fossa. Remember that the glenoid fossa is going to be right here, which articulates with the head of the humerus. Okay, so this is a tubercle that is inferior to the glenoid fossa. So we're going to call this the infraglenoid tubercle. The infraglenoid tubercle. Okay, now, so with this, we have all the landmarks of the scapula delineated for us. Beautiful. Now let's look at what we're dealing here with the humerus. Okay, so this right here is a tubercle that is projecting out laterally. You guys have also seen this in the previous video. This is known as the greater tubercle of the humerus. Okay, that's the greater tubercle of the humerus. And as we're going to see, the greater tubercle of the humerus is going to serve as an attachment site for three muscles, three muscles of which make up the rotator cuff. Okay, there are 4 muscles that make up the rotator cuff in total. Here we're going to see 3 out of those 4. All right, we're going to see 3 out of those 4. Okay, we continue over here. What is this? This is the shaft of the humerus, specifically the posterior aspect. So we're going to call this the posterior shaft of humerus. Okay, posterior shaft of the humerus. All right, then we look down here on the distal aspect of the humerus, and this is the part that articulates with the ulna to create the elbow joint. Okay. And specifically what you can see is that when we're looking at the posterior aspect of the ulna is going to terminate proximally as this projection of bone over here. And this projection of bone is called the olecranon. That's the olecranon, okay? The olecranon is the big bony prominence that you have on your elbow. You know, if you whack somebody with your elbow, you're essentially whacking them with your olecranon, okay? And similar to what we saw on the anterior aspect of the elbow joint, do you guys remember where the coronoid process of the ulna and the radial head of the radius, whenever you put the elbow into full flexion, that the radial head will fit into the radial fossa and then the coronoid process will fit into the coronoid fossa. We're going to see the same thing here, except this is going to be now for extension of the elbow. So if you go ahead and you extend your elbow right now as far as you possibly can, once you reach the terminal point of that extension, your olecranon process of the ulna, right? The olecranon process of the ulna is going to fit into this fossa right here that is on the humerus. And if you can guess, I know you know what this is called. This is called the olecranon fossa. It's called the olecranon fossa. Okay, I misspelled that, but you guys know. Wait, I'll fix it for you. The olecranon fossa. Okay, and the olecranon process and the olecranon fossa fit together like puzzle pieces whenever you go into terminal extension of the elbow. Okay, likewise, we've seen these guys before, right? These are the 2 epicondyles of the humerus. So this one right here, which one is this one going to be? Is this going to be medial or lateral? This is the medial epicondyle on this side, and this would be the lateral epicondyle right there. Okay, likewise, we've seen this guy before. This is the ridge that is superior to the lateral epicondyle. So we're going to call this the lateral supraepicondylar ridge. All right, the lateral supraepicondylar ridge. Okay, and we're going to see in the forearm. In the forearm is where we're going to see how these epicondyles and the epicondylar ridge serve as attachment sites for muscles that are going to travel more distally to cover the forearm. Okay, so these are the bony landmarks and muscle attachment sites that you need to know for the posterior scapula and the posterior arm. Without further ado, let's proceed to the individual muscles. Okay, so we're going to start with the deepest one of all, the triceps brachii medial head. So triceps means that it has 3 bellies. Okay, it has 3 bellies, and brachii is referring to the arm because brachium is the Latin term for arm. Okay, so the 3-headed muscle on the arm, the triceps brachii. Medial head. This is the deepest head of the 3. Okay, sometimes people will call it the deep head. I like calling it the deep head. Okay, but for all intents and purposes, I'm going to continue calling it the medial head for now. So the medial head, where is it attached to? So the medial head is going to attach proximally directly onto the shaft of the humerus. Okay, and recognize over here I say distal portion of posterior humeral shaft, right? So it's attaching down here. It's not attaching up here. It's attaching down here. Okay, and then the distal attachment where it's going to insert, the tendon is going to insert right on the olecranon process. Okay, so what does that look like? That's going to look like this. Okay, so it's sitting here and then inserts onto the olecranon process. Beautiful. That's the medial head. What's the next one we're going to talk about? Next one is going to be the lateral head. Okay, so we have the medial head sitting down here. The lateral head is going to attach on the proximal portion of the posterior humeral shaft. Okay, so it's going to attach up here. Okay, that's where the lateral head is going to attach, up here. And then distally, it's also going to attach to the olecranon process. So what is that going to look like? That's going to look like this. Okay, that's going to look like that. All right. Now, one thing I want to point out with this is that so it's attaching right here. There's going to be a small gap between the attachment sites of both of them. So the lateral head is going to cover this piece of bone. The medial head is covering this piece of bone. And there's going to be a tiny gap between those two. That gap right there is where you're going to find the radial nerve traveling. Okay, the radial nerve, which innervates this tricep, is going to travel through that groove right there. That's known as the radial groove. Okay, but that's for a future video on nerves and arteries. Okay, so that's the lateral head right there. You could see it's attaching to the olecranon process also. Next, we have the long head. The long head is the one out of the three that's not attaching. So it's attaching to the olecranon process because all three of them are, but this is the one that's not going to be attaching to the humerus. This one is going to be attaching to the scapula. Okay, so it's going to cross that shoulder joint, attach to the scapula, and then act as a shunt muscle along with the coracobrachialis and the short head of the biceps brachii. Remember in the previous video we talked about what shunt muscles are and what they do. So this is attaching to the infraglenoid tubercle, okay, the tubercle that is inferior to the glenoid fossa, the infraglenoid tubercle, and then inserts onto the olecranon process like so, okay. And right here we have 1, 2, 3 heads of the triceps, okay, and you can see how long head is over here on the medial side, lateral head is on the lateral side, and the quote-unquote medial head is in between the two and deeper. You can't see that medial head when these two are in place. In order to see the medial head, you would have to make a cut through these two heads to open up that space and then see the medial head that lies deep to those two. Okay. Now, all together, we can see how 1, 2, 3 heads are all crossing across the elbow joint. They're crossing posterior to the elbow joint to the attached to the olecranon process. Therefore, the one and only major action of this muscle is to extend your elbow. Okay. To extend your elbow, straighten out your arm and your forearm. Okay, beautiful. Next one, a small, well-known, I should not say well-known, a small, not too well-known, not too much spoken of muscle called anconius. All right, the anconius. The anconius is going to attach on here on the side of the olecranon process. So I put the lateral margin of the olecranon process, and then from there, it's going to go to attach to the lateral epicondyle of the humerus. Okay, so what is that going to look like? That's going to look like this. Okay, tiny muscle, doesn't have too much, like, it's not a huge function that it has, so sometimes people skip over it, but it's here for completion's sake. All right, next we're going to start talking about the scapulohumeral muscles, the muscles that run from the scapula to the humerus. Okay, and we're going to start off with the first rotator cuff muscle. This is a muscle that sits in the supraspinous fossa, right? The fossa that is superior to the scapular spine. It's going to sit in the supraspinous fossa, and then from there, the tendon is going to run superior to the shoulder joint and then insert itself onto the greater tubercle of the humerus. And specifically, I said the superior facet of the greater tubercle of the humerus. Now, depending on what course you're taking, they may or may not be this specific in terms of asking you which facet of the greater tubercle is. I think most curriculums, most anatomical curriculums will be okay with you just saying the greater tubercle of the humerus. But I included the superior facet, and you're going to see why as we go through the rest of the rotator cuff muscles, why I specifically stated the superior facet. So that's the supraspinatus, okay? The supraspinatus, and it's going to look just like that. Okay, sits in the supraspinous fossa, runs across and inserts right there. Beautiful. Next, we're going to have the infraspinatus. And yes, you guessed it, it lies in the infraspinous fossa. And then from there, it's going to insert onto the middle facet of the greater tubercle. Okay, the middle facet of the greater tubercle. And so this guy is not running superior to the shoulder joint the way the supraspinatus is. No, the infraspinatus is running posterior to the shoulder joint. Okay, it's running posterior to the shoulder joint. So that means that the supraspinatus is going to have one function, and then the infraspinatus is going to have a completely different function. All right, so The supraspinatus, running superior to the shoulder joint, when it grabs on this part of the greater tubercle, it's going to make it rotate up around this way, which is going to make the whole entire humerus move up and around this way. All right. What is that called? That is called abduction of the humerus. Okay. Abduction of the humerus. This guy back here, infraspinatus, is not in a position to cause abduction of the humerus. No, it's going to grab on this middle facet of the greater tubercle of the humerus, and it's going to pull it towards us, right, out of the screen towards us, and that's going to make the whole entire humerus rotate around towards us. And specifically, that rotation is a lateral rotation, also known as external rotation of the humerus. Okay, that's what the infraspinatus muscle does. All right, beautiful, beautiful, beautiful. Okay, next one, we have the teres major. All right, the teres major. So the teres major is not a rotator cuff muscle, okay, because as you can see, it's not going to attach onto this greater tubercle. Okay, all the rotator cuff muscles are going to attach either to the greater or the lesser tubercle of the humerus. Okay, that's their insertion point. This teres major is going to attach onto the medial lip of the intertubercular groove of the humerus. Okay, that's a mouthful. Let's break it down. You guys saw in the previous video when we looked at the anterior aspect of the arm how there was a groove that ran in between the greater and the lesser tubercles of the humerus, correct? And we call that the intertubercular groove, which also has another name known as the bicipital groove, because that is the place where the long head of the biceps tendon courses. Okay, so the intertubercular groove of the humerus, all right, is going to be the attachment site for this teres major. So what does that tell us? That tells us that this muscle is starting on the posterior aspect of the scapula, but then it runs anteriorly. Okay, remember, this is all three-dimensional. This is all three-dimensional. So the teres major is going to course anteriorly to then insert itself on the anterior aspect of the humerus, but it's starting on the posterior aspect of the scapula. Okay, it's starting on the posterior aspect of the scapula. So what is that going to look like? That's going to look like this. Okay, so notice how this long head of the triceps brachii is essentially running superficial to the teres major. Okay, the teres major is going to cross deep to this long head of the triceps brachii. Okay, and then all together, you see that with this muscle in place, now we can see the formation of this space right here that has four sides to it. Okay, this is known as the quadrangular space, and this is the space that is going to house the axillary nerve and the posterior humeral circumflex artery. Okay, very important is the axillary nerve that runs through here. Okay, it starts from the brachial plexus that is anterior to this and then courses posteriorly to run through here to then reach the deltoid, which we're going to see later on. So that's the quadrangular space, and then this right here, you see this forms a three-sided space known as the triangular interval, and that's where we're going to find the radial nerve and the deep brachial arteries. Okay, we continue now. So that's the teres major, and in terms of function, if we see the teres major starting posteriorly here on the scapula and then runs to attach onto the anterior aspect of the humerus, okay, specifically to the medial lip of the intertubercular groove, when it contracts, it's going to pull that medial lip this way. So it's going to cause this whole entire humerus to rotate. And specifically, it's going to rotate in the complete opposite direction that we saw the infraspinatus do. So this is going to rotate medially or internally. Okay, this is going to cause internal rotation of the humerus. But more importantly, look at the position at where it's at right now. Imagine that you had this humerus in a completely abducted position, right? Where the humerus is extending out this way in an abducted position. This teres major would then effectively serve to bring the humerus back to your side. Okay, what is that motion called? That is called adduction of the humerus. Okay, so the teres major can do both adduction of the humerus and internal rotation of the humerus. All right, beautiful, beautiful. Next, we're going to talk about the teres minor. The teres minor is starting here on the lateral border of the scapula. It kind of fits into the space between the teres major and the infraspinatus. And then from there, it's going to run similarly to the infraspinatus, course posteriorly to the shoulder joint and insert itself onto the inferior facet of the greater tubercle of the humerus, okay, to complete the third rotator cuff muscle that we can see from this view, okay. The fourth rotator cuff muscle is on the anterior side of the scapula, and it's known as a subscapularis, okay. So this one is going to look like so, all right. And just like the infraspinatus, it's going to do the same exact thing because it runs, because it courses posterior to the shoulder joint. So it's going to cause external rotation of the humerus, okay. External rotation of the humerus. Beautiful. Beautiful. We covered all those guys. Now, the last and final muscle to talk about, and this is going to be the one that's going to essentially cover everything that's happening over here, okay? So this is going to be the posterior aspect of the deltoid. Remember that the deltoid is a muscle that essentially covers the whole entire shoulder joint on the anterior side, on the lateral side, and also on the posterior side. So from this view, we're going to look at the posterior deltoid. It's going to attach to the scapular spine, to the acromion process, and also to a rough patch of bone on the humerus right here that's called the deltoid tuberosity. What is that going to look like? That's going to look like this. Okay, so you see how this posterior deltoid effectively covers everything that's going on here. So remember I told you that there's going to be an axillary nerve coming out of this quadrangular space that's deep to this teres minor. It's going to come out of there, okay, and then run into the posterior deltoid. So the posterior deltoid is sitting right over that, okay. So as soon as that axillary nerve comes out of that space, it's going to run, boom, it's going to run right into that posterior deltoid to innervate it, okay, to innervate it, to control it. The posterior deltoid, what is its function? The posterior deltoid is going to cause extension of the humerus, okay. So it's essentially going to pull your whole arm posteriorly, and it also contributes to abduction of the humerus. The whole entire deltoid is a huge abductor of the humerus, okay? But the individual parts do different things. So the posterior deltoid is going to do external rotation or quote unquote contribute to external rotation and do extension at the shoulder, whereas the anterior deltoid is going to do the opposite. It's going to do internal rotation and flexion at the shoulder, all right? So those are all the muscles of the posterior arm and scapula. Those are the muscles that control both the shoulder joint and the elbow joint, okay? Gross anatomy is one of the most difficult subjects in the world. Luckily, it doesn't have to be. Anatomy is one of those subjects that needs constant verbal and visual repetition in order to get good at. What better way to reinforce this information than with the scientifically validated method of drawing? Neuroscience has shown us that we retain information better when we physically draw it out. That is why the Gross Anatomy Study Strategy Workbook is designed to walk you through all the layers of the musculoskeletal system, allowing you to draw the muscles into place. This is excellent for reinforcing muscle attachments, bony landmarks, muscle names, and actions. This will save you tons of time from mind-numbing tactics such as repetitive flashcards or passively listening to boring lectures. With this strategy, you can actually begin to enjoy studying again and have a much better way to retrieve the information. Order a copy of the Gross Anatomy Study Strategy today at the link below so you can spend less time being stressed and more time being blessed.